Hi, Dr. Hudak here. I'm going to be talking a little bit about Celluma, which is the world's most awarded medical LED device, which we can use without any downtime, no needles or anything like that, to treat acne, to treat wrinkles, to treat pain, and to treat wounds for quicker closure of wounds and healing. It's all based on lights because we know that depending on the light wavelength, we can penetrate deeper layers of the skin and affect the kind of changes we want. With the blue light, we're going pretty superficial, and therefore we affect specifically bacterial cells. Red light will go down into the dermis, where it can affect fibroblasts, causing them to produce more collagen and elastin. Near infrared will not only get all those tissues, but get down into the muscle itself to help out to get rid of inflammation and to ease with the pain and swelling that we see when a person's injured, to take care of that quicker. I'm going to show you that the technology for this goes back to DARPA and NASA before they sent men up to the moon, where they needed to figure out how they would be able to get an injured astronaut healed fast, without pain and without infection. And they were able to actually figure out exactly which cells would be affected and in what way they would be affected. Specifically, when we're talking about acne, we're talking about, as I said, it's going to go down and penetrate and get into the bacterial cells, where there's going to be an implosion of the actual bacterial cell. Pretty cool. Number two, if we're trying to treat wrinkles, it's actually going to go down into the cells of the fibroblasts, where it's going to go into the mitochondria of the cell, cause an increased amount of ATP production that will specifically result in an increased amount of collagen and elastin, two of the main connective tissues that undergo lots of changes related to wrinkles and sagging of our tissue. With pain, using near-infrared light, it's going to specifically target the cells in both the dermis as well as in the muscle that have to do with healing and causing an increased amount of blood supply and circulation to the tissue, thereby relieving the person of pain. And when it comes to wound healing, we usually use a combination of both the red lights and the near-infrared light wavelengths, each treatment being 30 minutes long, and it leads to an improved wound healing. See our Wow Wednesdays to see photographic proof of this, and look on our YouTube channel for another more in-depth look. Thanks so much.